Do you have plantar fasciitis and your heel is killing you? Do you want to avoid being stuck in orthotics, being able to keep running, keep active, keep working, and avoid heel pain? Make sure you watch this video. I'm going to give you some top tips on what we would recommend for heel pain, how we go about fixing it, and how we help to alleviate it. My name is Daniel Fitzpatrick from Sydney Foot Solutions. We see over 100 cases of plantar fasciitis and heel pain a week. We treat it very, very effectively and have done for over 20 years. So what I am going to go through today is one of our patients that has just had a really great result in regards to his plantar fasciitis. He came to see us. This particular guy is a roofer and he can't wear orthotics with his job. So what I'm going to do is I'm going to talk you through what we did for him. I'm going to show you the exercise that we've given him that have been very, very successful. And if you can't make it into our clinic, these might be helpful to you and help with your plantar fasciitis because they're very well researched around plantar fasciitis and heel pain. So this particular gentleman had tried orthotics. They were unsuccessful. He just couldn't wear them in any of his shoes. And he's had heel pain for over 6 months. It was driving him crazy, particularly around the golf course and particularly when he was at work, even to the point where he was having difficulty climbing ladders, which is a pretty big deal if you're a roofer. And so he's getting that classic sort of heel pain through here. Just for the record, plantar fasciitis, at the end of the day, your plantar fascia is fascia. So it's micro tearing through your fascial tissues. So your fascia runs from here down to here. You get little micro tears through this area here. They bleed and they get quite sore and they get very flared up through that area as well. And as a result of that, they can get incredibly painful very, very quickly. And part of the reason they accelerate so quickly is the fact that you don't feel the first 90% of plantar fascial sort of symptoms. So this particular gentleman presented with us. He'd had the pain for about 6 months before he came to see us. And needless to say, he was in a bad way. It was affecting his livelihood, not to mention it was affecting his life in a really negative way. And he couldn't keep doing the things that he loved. So we started a course of treatment based on the fact that he did not want to be stuck in orthotics. And the way we did that is through a very gentle hands-on technique called foot mobilization, where we work on correcting that level of alignment. We gave him exercise to support the changes, which I'm going to show you in just a moment. So make sure you keep watching. And we also bombarded the area with laser. And the great thing about laser is it stimulates healing, but it also breaks up pain and gives really significant pain relief without any negative side effects. So needless to say, and the great thing about laser is it starts to make you feel better even after one session. So if you do have access to someone who uses a laser, obviously a health professional, then make sure you hit them up. They're really quite effective tools and we get great success with that here in our clinic. So the two exercises that we used for this particular gentleman in combined with laser and the manual therapies that we did use is our dowel exercise and our one off the step with the towel. So this is our dowel. So the reason we use this is, and what the dowel's been used for, is that we use it to break up the tightness underneath your foot. And you sort of start it here and work your way down, which I'm going to demonstrate now. So fascia, just for the record, loves tough love. You don't, but it does. And so what this does is it helps to promote and stimulate an increase in fascial cells. What's been shown with this exercise is that it not only speeds up healing, it makes your fascia far more robust for the rest of your life. You end up with stronger, thicker fascia for the rest of your life, fasciitis forever. So really great one to do. Just for the record, it will hurt when you first do it. I'll show you the nice version and then I'll show you the harder version and you can build your way up to it. So you need yourself a broomstick or something a bit like that. That's just a dowel if you're wondering. What you do is you pop this here and then you walk along a bit like that. So that's the hard way. I'll go back a step and show you the 1 foot. So the way we do this one is you walk along 1, 2, 3, 4, 1, 2, 3, 4. 1, 2, 3, 4. And you stop for 4 seconds wherever it hurts. So you want to keep it like a 5 or a 6 out of 10. If it hurts too much, put more weight on this side, and so that you don't have to put as much force through that particular area. If you find that that's pretty okay for you and you can get by with that, then try 2 feet. And what you do is you work your way along. When you hit a sore spot, stop. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4, and it's just breaking up that tightness underneath that area. Really loosens up all those tissues. So what it does is it loosens up through that area and stimulates all that healing and all that really good stuff happening in there. But you end up with stronger, thicker fascia for the rest of your life. So that's the loosening part. What we also find is it's really important if you suffer with plantar fasciitis to strengthen through this particular area here as well. And so the way we do that is we use a towel and we put it on a step. And then just like that. And then we go down, 1, 2, 3, and then up, 1, 2, 3. So what you might find when you first start, this irritates the area a little bit and that you're quite weak through that area. So I would start with 2 feet and then build up to 1 foot. And what that does is it really starts to build up all through these tissues in here. Really great exercise for strengthening your foot and ankle, great for stability, great for a whole range of things. So I strongly encourage you to give that a crack. So these have worked and been very successful for us for a number of years, over thousands of cases of plantar fasciitis. We would strongly encourage you to try them at home. What I would say is if you need any extra help, check out our 60% off initial heel pain assessment. I hope you found this video helpful. I hope that we can be of assistance to you. Please like the video and check out our channel. If you like what we've got on there, please subscribe. We try and produce new videos every week. Thank you very much for watching.